Now, of course, nobody wants to fall ill over the holiday season, but if you do, this is the place to come if you need some help. I'm joined by Phil at Hauser Pharmacy here in Hamilton. And Phil, this is such a beautiful store. That was my first impression when I walked in. I thought, what a great looking pharmacy. You've got the things for mobility issues right in the center. You've got all the things that you would ever need to find in a pharmacy laid out, easy to look for. Tell me a little bit of history about this place.
Well, Hauser's Pharmacy goes back 40 years. My parents started Hauser's back in 1980 and I took over in 2007. Our hallmark is building these great stores that we can have comprehensive health care. So we've got not only equipment and drugs, but we focus on the care of the individual and everything that kind of goes into that. We recognize that, as a pharmacy, it's very easy to think that we go from a big bottle to a little bottle, but there's so much more that goes into what we do every day for all of our patients. Mm-hmm. And we've had an innovative approach to pharmacy over the years. We were one of the first pharmacies in Ontario to bring in computers into our dispensaries and kind of automate some of those processes. We were one of the first pharmacies to remove tobacco from our shelves as well, which was a really big financial decision at the time when everybody was smoking, and this was something that we felt very passionately about, that as a pharmacy we have to be involved in everybody's health, and if we're going to do that, that means that we have to stand up for what we think is right. And I think that's kind of inspired me through my tenure here to be able to make sure that we're on the forefront of healthcare and that we are going to bring in as many products and as many services as we can to kind of be able to support our patients. Now, that means, we were one of the first pharmacies that got injection training way back when, and we were one of the first pharmacies to be able to do flu shots. Our first year, we did 1,500 flu shots. And last year, during COVID, we did over 50. I personally have done over 15,000 COVID shots for people. So we feel it's very important for us to be there for people when they need us and not just when it's convenient for us.
So a real family first approach.
Absolutely. I want everybody that comes in here to feel like, you're being treated just as I would treat my grandmother or my parents.
That's amazing. Okay, well, we've got lots more coming up. We're going to be talking about the medication shortage, of course, not necessarily just for kids, but for adults as well. Phil's going to give us a bit of a rundown, and we'll check out some of the stuff that they have in store for mobility issues. Lots more coming up on Morning Live. Now, Phil, as a busy mom of two, sometimes my kids get sick and I can't do anything about it except for go to the drugstore and buy them medicine to make them feel better. But unfortunately, in the last 6 months to a year, that has been almost impossible, to the point where I actually had to get my father down in the States to bring kids' medication to me in Ontario. What's going on with this shortage, and do you have any updates?
We've been seeing this shortage happen for a number of months now, and I know that for everybody it kind of hits them when they need it, and medicine is there when you're sick and when you need it, and not necessarily when you don't. But what we're seeing is that across a number of different categories, a number of different products, they're all being back ordered, and when they do come in, there are a lot of people that are looking to have that medication on hand. And what we're asking people to do is only to look for that medication when you do need it, so that we can kind of get what we do have in stock out to people that need it when they need it. But it's something that we've seen across adult medication as well as cough and cold medication, as well as a lot of children's medication as well, which invariably becomes a hot point for most parents.
Well, you panic.
That's right.
Right? And you've got your kid and the kid's, got a fever of 104, and you immediately think, I need to do Tylenol, I need to do Advil. But I think the last time one of my little girl had a fever, I had to put her in a lukewarm bath because I just didn't have any Tylenol.
Absolutely. And that's exactly where pharmacists can step in and help. Now, one thing that we do here at Hauser's is we compound a lot of medication. So if there is things that you can't find on the shelf, we can mostly make a lot of those things up. So Advil, Tylenol, some of the children's antibiotics, we're making those and putting those into forms that the kids are going to take too. The great thing is that if those aren't available, we can also give you advice on how to use some of the adult medication for kids as well. Now, I wouldn't recommend anybody doing that without the advice of a pharmacist.
No, I
but
never
that's
would.
Something, and that's why we're so accessible, is because we want to be there when people need us to.
Yeah, I didn't even know that there was even an option to do stuff like that. So that's actually really, really helpful to know. So of course we wouldn't do it on our own, but you talk to your pharmacist, come into Hauser Pharmacy in Hamilton. Talk to Phil. He will help you get those runny noses and fevers a little bit less. Coming up, we're going to be talking about mobility, and we're going to be talking about how this is a family-run establishment. And Phil, well, it's been here for years. All that coming up and more. acid tannic, zinc sulfate, something citrate. These are very cool to look at because it's a piece of history. I know that some of these came from your original pharmacy that you guys have just kept over the years that have expired, but I think it's a really good telltale sign of how far pharmacies have actually come during the years.
That's a really good point, Emily. And this kind of reminds us of where we came from, but also where we're going, because right next to those, we have things that are inserted into small computers.
Right.
And so you look at 100 years worth of history, and here we are now even expanding the role of pharmacists beyond just dispensing. And as of January 1st, pharmacists are going to have the ability to prescribe for 13 different minor ailment conditions.
Can you tell me about any of those?
Sure. So some of these are for simple herpes infections to uncomplicated urinary tract infections. We've got fungal infections that we're going to be able to prescribe for,
wow.
Just to name a few.
Yeah.
Now this is something that's going to be new for Ontario. It's not new to Canada,
right.
But Ontario pharmacists are very excited to be able to kind of do a lot of this, especially when you consider that pharmacy and pharmacists have been on the front line of the pandemic for the last 2 years, doing a lot of those injections, being open when everybody else was closed. And we are a resource within that healthcare system, or within our healthcare system.
Absolutely. I feel like it's gone a little bit unnoticed that pharmacists have been taking such a huge role in being on the front line.
Well, and I don't think we're, nobody gets into the pharmacy for the glory.
No.
Right? but we're here because we want to help, right? And I think that most people, and especially the people that work at Hauser's Pharmacy, are here to make sure that we help people. And we don't need a pat on the back for that. We're happy just to make sure that your health is taken care of.
And you've got past files here from the COVID vaccines, which you're right, it is going to be a part of history.
That's right. Yeah, we really feel that this was a seminal moment for pharmacy, and to be a part of it has been taxing. It's been a lot of work, but it's been an honor to be there.
Yeah. So if you're in the area and you're looking for a good pharmacist, Hauser Pharmacy, it's got a great family history. It's local and it's a beautiful store. Just being in here and looking around at the space and all the different types of products you have. It's been very educational for me, and we're going to learn some more stuff coming up. So join me. Wow. My grandmother had one of these chairs, and I used to love playing with it when I was a kid because I thought it was so neat. Phil, I'm going to fall on the floor in a second, but this is amazing. This just takes all of the effort. If you have any kind of mobility issues, if you're elderly, this takes all of the effort out of having to actually stand up on your own.
Absolutely. And that's one of the things that we try and do with our stores, is that we're not here to sell you cosmetics, and we're not here to sell you salami. We're here to sell you healthcare products, right?
Salami.
Right? So all the bracing that we have here, the ostomy products, the compression products, everything here is to complement anything that we need to do to make you better. So there are things that we can do preventatively. There are things that we do when there are issues with your health. So our mobility products is a huge component of that. So if we need rentals, we do rentals as well. We do lifts. We actually do some home modification, and our guys go in there. We widen doors. We'll put in ramps. We have stair lifts that we can install. Hauser's Home Healthcare, a component of what we do here, is one of the largest home healthcare mobility providers in Niagara, Hamilton, Brantford, Haldimand, and Norfolk, and into Burlington as well. So we cover about 9,000 square kilometers. We do deliver. We do free deliveries for all of our customers. We, often I'll say that if you're willing to come see us, we're willing to come see you, which means that wherever you are, we'll take care of you.
That's a great catch line. I love that.
Yeah.
No, that's great, because people really think about that, especially when you've got a snowstorm like we've been experiencing this last week. People don't necessarily want to go out. They don't want to travel. They want someone to come to them and help them in their moment of need if they're not feeling well, or if they've got something breaks and a mobility, one of your apparatuses, they want someone to be able to come and help them out.
Absolutely, and we recognize that is the need, right? That we have to be more reactive, and we have to be there exactly when you need us, and not 2 days later. It's not, you call in your prescription on Monday and we get it to you on Thursday. If you need it, it's something that we recognize that it's important for you, and it should be important for us as well.
All right, well, thanks so much for having us in today.
It's
I've certainly
been a
learned a lot about mobility issues that I could potentially have in the future and where to come to shop for them at Hauser Pharmacy here in Hamilton.